Dear students, welcome back. In this session, we are going to discuss about extensor retinacula. This extensor retinacula is the modification of the deep fascia. So the deep fascia is thickened to form bands like around the ankle, and these are called as extensor retinacula. There are two extensor retinaculum are present. One is the superior extensor retinaculum, another one is the inferior extensor retinaculum. Okay, so now we will see one by one. Superior extensor retinaculum. This one is the superior, the green band structure which is shown here, that is called as superior extensor retinaculum. If you see the attachments, so this one is the medial side and this one is lateral side. Medially, it is attached to the lower part of the anterior border of the tibia. And laterally, it is attached to the lower part of the anterior border of the fibula, forming the anterior boundary of the elongated triangular area just above the lateral malleolus. Just above the lateral malleolus, this one is forming a boundary which is just above the lateral malleolus on the elongated triangular area. Okay, and this is the attachments of the superior extensor retinaculum. If you see the inferior extensor retinaculum, this is a Y-shaped band. So here you can find this is a Y-shaped band like this, and which is situated in front of the ankle joint. So this one in front of the ankle joint and over the posterior part of the dorsum of the foot. And over the posterior part of the dorsum of the foot. The stem of the Y lies laterally and the upper and lower bands medially. This one is upper band and lower band, which lies medially. If you see the attachment, the stem is attached to the anterior non-articular part of the superior surface of the calcaneum. So if you see the extension of this inferior extensor retinaculum, which is somewhat present on the posterior part of the dorsum of the foot. So that mainly the stem part which is attached to the superior surface of the calcaneum. Calcaneum is present on the posterior part of the foot, isn't it? Yes. And especially in front of the sulcus calcaneae is the attachment of the stem part of the inferior extensor retinaculum. Okay, so the upper band passes upwards and medially and is attached to the anterior border of the medial malleolus. It is attached to the anterior border of the medial malleolus. The lower band passes downwards and medially and is attached to the plantar aponeurosis. Actually, the plantar aponeurosis which is present on the plantar aspect of the foot. That means this is also deep fascia modification, isn't it? Extensor retinaculum. The plantar aponeurosis is also the modification of the deep fascia. So, but it is seen on the plantar aspect. So, this inferior or the lower band of the inferior extensor retinaculum, which passes downwards and medially and is attached to the plantar aponeurosis. So what is the main function of this extensor retinaculum means? Here, this retinaculum mainly retain the tendons in place. Okay, that is the main function of this retinaculum. Now if you see what are the structures which are passing below this extensor retinaculum, now we will see the structure passing under the cover of extensor retinaculum. We will see from medial to lateral side. This one is medial and lateral side. So the first one is the tibialis anterior tendon, and next one is the tendon of extensor hallucis longus. After that we can see the anterior tibial artery and deep peroneal nerve. Okay. Next one is the peroneus tertius. So we'll come to the lateral side. The final one, before this peroneus tertius, extensor digitorum longus. So these are the structures which are passing under the cover of extensor retinaculum from medial to lateral. One is the tendon of tibialis anterior, tendon of extensor hallucis longus, anterior tibial artery, deep peroneal nerve, extensor digitorum longus, and peroneus tertius. So if you see, there are 4 tendons, 2 on the medial side and 2 on the lateral side. On the medial side we can find tibialis anterior muscle and extensor hallucis longus. So the great toe is nothing but hallucis. This tendon is supplying to the great toe. So on the medial aspect we can find tibialis anterior and extensor hallucis longus. Okay. If you see on the lateral aspect, you can find the extensor digitorum longus and peroneus tertius. So the remaining digits are supplied by this extensor digitorum longus and the peroneus tertius. The last one is the peroneus tertius. So these are the 4 muscles, tendons which are passing under cover of it. In between these 4 tendons, you can find one artery, one nerve. On the medial side you can find tibial artery, and lateral to the tibial artery you can find the peroneal nerve. So as I have mentioned already, the main muscles which are present on the anterior aspect are the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. That means the tendons which pass below this extensor retinaculum, that is front of the leg and the dorsum of the foot, is also the same 4 tendons. 4 muscle tendons only pass. So now how many tendons? 4 tendons and 1 artery and 1 nerve are passing under the cover of extensor retinaculum. So we have discussed the structures which are passing from medial to lateral aspect. So there is a mnemonic called tall Himalayas are never dry places. So with that you can remember the structures which are passing under the cover of extensor retinaculum from medial to lateral aspect. So T represents the tibialis anterior and H represents the hallucis muscle, that means extensor hallucis longus. A represent here the Himalayas are A. A represents the anterior tibial artery. N represents the nerve, that is deep peroneal nerve. D represents the digitorum, that is extensor digitorum longus muscle. And P represents the peroneus tertius tendon. So these are all about the extensor retinaculum. Thank you.